Hello, this is Travis Marks, and I'll be teaching you guys how to correctly perform the static posture assessment as well as the dynamic movement assessment. We'll be going through the corrective exercise continuum, specifically focusing on arms falling forward. This is a rundown on what I want to talk to you guys about today. Besides the static and dynamic assessment, we'll be going through the overhead squat, push-up assessment. We'll be going through range of motion measurements, manual muscle testing, and then lastly, we'll go over the corrective exercise strategies on how we can correct the arms falling forward. First, we would have to inhibit the overactive muscles as well as lengthen them. We'll also have to activate the weakened muscles, which is also known as underactive muscles, and we'll integrate them together. So we'll incorporate exercises that integrate both underactive and overactive muscles. Starting with the static posture assessment, here we have the anterior view of my client. Starting with the shoulder complex, we can definitely see that his right shoulder is slightly elevated than his left shoulder. Looking at his LPHC complex, we can see that it's fairly neutral, nice and even. His knees as well is nicely even. Looking at his ankles though, however, you can definitely see his feet are turning out. Although we are primarily looking at the shoulder complex, we can definitely see that there are other compensations in this client that we could potentially fix. Next up, we have the lateral view of my client. As you can see, his posture looks fairly neutral with the midline from his shoulders down. The only concern that I saw was that his ears are not lined up with the midline. We can see that his head is protruding forward just slightly. And this is important to note down as we go through the overhead squat assessment. Lastly, we have the posterior view of my client. We can definitely see a better view on his right shoulder. It's definitely elevated, and that needs to be taken into consideration once we're doing our overhead squat assessment. The other compensation that I can see is his feet are definitely turning out, so we'll definitely keep that in mind as well. Here in the overhead squat assessment, this is our anterior view of my client. As you can see, as he goes down, you can see that his knees want to cave in, so I would most likely write down his knees move inward. Also, you can see that his feet are externally rotated and his feet turn out as he goes down. And here we have a picture of the bottom phase of his squat. You can see that his left knee is not lined with the midline, and you can definitely see that there is a feet turning out on the left ankle. Here we have the lateral view of the overhead squat. In this view, we're looking for compensations such as the arching of the back, excessive forward lean, and the arms falling forward. Here we can see that his posture is perfectly parallel with each other. We can see that he has no arching in the back or excessive forward lean, but we do see that he does have arms falling forward. You can see that his elbows are not lined up with the midline. And lastly, we have the posterior view of the overhead squat. We can see that as he squats down into the overhead squat, we can see that he has a asymmetrical shift to the left. We can see that his feet also externally rotate. And this is a photo of the bottom phase of the squat. So as he squatted down in the overhead squat assessment, he had a tough time keeping his elbows close to his ears as I instructed him to. This is an indicator that he could possibly have tight pectoralis major muscles in his chest. I also noticed with the asymmetrical shift in his LPHC, we can see that it's possibly due to tight adductors, tight TFL muscles, or weak glutes or underactive glutes. Last thing I like to point out is his foot pronation. He has slight foot pronation in both of his feet. This could be due to overactive gastrocnemius muscles or his hamstrings, and underactive muscles would be the anterior and posterior tibialis muscles. Next up, we have the push-up assessment. Within this assessment, you instruct your client to perform 10 easy reps at a 202 tempo. In this assessment, you are assessing his LPHC and his shoulder complex and make sure they are aligned with each other. you would see any compensation such as scapular winging. In this case, he doesn't, but typically a client with tight lats and tight pecs, you would see scapular winging. For our shoulder flexion range of motion assessment, we will be using a goniometer to measure the angle. To place the goniometer in the right location, you will place the axis of the goniometer at the lateral side of the shoulder, 1 inch away from the acromion process. The stationary arm will be placed at the mid-auxiliary line of the thorax, and the movement arm will be placed at the lateral midline of the humerus in reference to the lateral epicondyle. Our client obtained a score of 150 degrees at the right shoulder and 140 degrees at the left shoulder. Normal range of motion in this assessment is 160 degrees. It is expected that our client does not obtain full range of motion in this assessment, as we are assessing the chest primarily. Due to the fact that they did not reach full range of motion at 160 degrees, we can confirm that their pectoralis major may be overactive. Next, we have the manual muscle test for the lower traps. In this assessment, you will have the client prone and in scapular adduction and depression. You will instruct your client to resist against you like you see in the video. You would score your client with a 3 if they have normal strength, 2 if they compensate, or with a 1 if they are weakened. In this case, we are expected to see a 2 or 1 in this lower traps. Now that we established the range of motion and the manual muscle testing of our overactive and underactive muscles, we can now incorporate that within the corrective exercise continuum. For the first phase of the corrective exercise continuum, you would have your client SMR their overactive muscles. In this case, since their arms fall forward, it is most likely that their latissimus dorsi are overactive. You would have your client place the foam roller under their armpit, just directly on their latissimus dorsi. Once they find a tender spot, you would have them hold it for 30 seconds. The next phase in the exercise continuum is the lengthening phase. Within the lengthening phase, you will typically have your client static stretch the same overactive muscle that you previously SMR'd. In this case, my client previously SMR'd his lats, so I had him go through a ball stretch. You would instruct your client to hold this position for 20 seconds. Once they have completed that 20 seconds, you would instruct your client to do the same thing on the opposite side. Have your client maintain a neutral spine and hold that posture for 20 seconds. The third phase of the corrective exercise continuum is the activation phase. In this phase, you would focus primarily on the underactive muscles, which in this case is the mid to lower traps. We want to activate the mid to lower traps, so I had my client go through a ball cobra exercise. I instructed my client to go through this with a nice and easy pace between 10 to 15 reps. I had him go through each phase with each contraction with a 2-second isometric contraction at the top. And last but not least, we have the integration phase of the corrective exercise continuum. The purpose of this phase is to integrate both underactive and overactive muscles in which the client possesses. The perfect exercise to perform on clients with this impairment of arms falling forward in their overhead squat assessment is the squat to row exercise. This exercise incorporates both using the underactive muscles, which is the mid to lower traps, and the overactive muscles, which is the lats and the pecs. Unfortunately, I did not have the equipment to have my client go through this exercise. However, this is a great exercise to perform on those with this impairment.